Hi, my name is Patti Olusola, and I'm one of the family physicians here at the University of Texas Health Science Center in Tyler. I'm an associate professor of family medicine here and work in the family medicine clinic, where I see women who, for their well woman exams, as well as women who've had abnormal pap smears. So I have a special interest in women's health, and this month of January is Cervical Cancer Awareness Month. So I wanted to take a few minutes and talk to you about cervical cancer. In the United States, cervical cancer still affects about 13,000 women and still causes about 4,000 deaths each year in the United States, despite good screening programs with pap smears and HPV testing, as well as prevention through HPV vaccines. So I want to encourage women to get screened if you haven't been screened, or talk to your primary care physician about being screened. Cervical cancer, we know, is caused by the human papillomavirus, the high-risk viruses. There's about 40 of these types out there, and there's several of them that are associated with cervical cancer. In addition, women who smoke and who are immunocompromised for various reasons, including HIV infections, are at higher risk. All women over the age of 21 should be screened for cervical cancer. Between the ages of 21 and 30, that should be done with a pap smear at least every 3 years if it's normal. For women over 30, between the ages of 30 and 65, women should be screened with pap smears, and they may also be screened with an HPV test. If it is only with a pap smear, that should be done every 3 years. If it's done with an HPV test, then that can be extended to 5 years. Over the age of 65, if you're at low risk and have had normal screening in the past, you may not need further screening. But if you are at one of the higher risk groups or have had abnormal pap smears in the past, your doctor may continue to recommend screening for you even after the age of 65. Cervical cancer can be prevented in several different ways. One of the most important ways is to go ahead and get screened as recommended for cervical cancer, either through HPV testing or pap smears or both. If you smoke, try to quit, or if you're not smoking, don't start smoking. And also try to decrease your exposure to HPV virus through having limited sexual encounters, or if you do, use a condom every single time. The other thing and most important thing you can do is get vaccinated against HPV infection. And that usually is done between the ages of 9 and 45. It's FDA approved down there, but usually done in the adolescent age period. So I'd encourage you, if you haven't been vaccinated, to talk to your healthcare provider about being vaccinated. If you have more questions about cervical cancer screening, vaccination, prevention, please contact your healthcare provider today. And if you don't have one, we'd be happy to be that healthcare provider for you.